Studies show that people in Kenya aren't getting HPV vaccinations because there is a lack of knowledge about HPV and the HPV vaccine. Ruth understands that there are three main barriers to helping her community getting vaccinated that her program needs to overcome. Number one, lack of knowledge among parents. Number two, lack of knowledge among healthcare workers. And lastly, issues with accessibility and social norms. Ruth wants to ensure that she can share correct information about vaccinations and HPV vaccines to help her community overcome any misconceptions. Welcome to this unit on why is it important to get an HPV vaccination. By the end of this session, you'll be able to explain vaccines and how they work to fight off diseases, explain the HPV vaccine, explain why it is important to get the HPV vaccine, help address fear, myths, and misconceptions about the HPV vaccine, and talk to families about HPV vaccines. What is a vaccine? Vaccines help the body learn how to defend itself from disease without the dangers of getting ill. How do vaccines work? Vaccines reduce the risk of infection by working with the body's natural defenses to safely develop immunity to disease. Most vaccines contain a weakened or an inactivated, killed form of a virus or bacterium, or a small part of the virus or bacterium that cannot cause disease. This is called an antigen. When a person gets a vaccine, the immune system recognizes the antigen as foreign. This activates the immune cells so that they kill the disease-causing virus or bacterium and make antibodies against it. Let's talk more about vaccines. Different vaccines bring about different levels of protection. Some vaccines can only protect against a disease for a short period and may need booster doses. For others, immunity can last a lifetime. Vaccination does not only protect people who have received a vaccine, it indirectly protects unvaccinated people in the community, such as children who are too young to be vaccinated or people with weakened immune systems. This community immunity, also called herd immunity, needs enough people in an area to be vaccinated. The HPV vaccine. HPV vaccine safety. HPV vaccination provides safe, effective, and long-lasting protection against cancers caused by HPV. Over 15 years of monitoring have shown that HPV vaccines are very safe and effective. Like all vaccines, scientists continue to monitor HPV vaccines to ensure they are safe and effective. HPV vaccine side effects. Vaccines, like any medicine, can have side effects. Common side effects from HPV shots are mild and get better within a day or two. These include pain, redness, or swelling in the arm where the shot was given, fever, dizziness, or fainting. Fainting after any vaccine is more common among adolescents than others. Nausea, headache or feeling tired, and muscle or joint pain. Preventing fainting. To prevent fainting and injuries from fainting, adolescents should be seated or lying down during vaccination and for 15 minutes after getting the shot. Fainting after a shot is normal and more common for adolescents. HPV and fertility. HPV vaccine does not cause fertility problems. Not getting HPV vaccine leaves people at risk for HPV cancers and precancers, which are abnormal cells that can lead to cancer. People who develop a cancer caused by HPV will need treatment that can sometimes limit their ability to have children, such as a hysterectomy for women, chemotherapy, or radiation. Treatment for cervical precancer could also put women at risk for problems with their cervix, which can sometimes cause preterm delivery. Who should get vaccinated? Early protection works best. It is recommended to be given to children aged 10 to 12 years, but can be given starting from age 9. All preteens need HPV vaccination, so they are protected from HPV infections that can cause cancer later in life. That's why HPV vaccine is recommended earlier rather than later. It protects your child long before they ever have contact with the virus. Teens and young adults through age 26 years who didn't start or finish the HPV vaccine series also need HPV vaccination. Vaccination is not recommended for everyone older than age 26 years. Some adults aged 27 through 45 years who are not already vaccinated may decide to get HPV vaccine. However, HPV vaccination in this age range provides less benefit because more people in this age range have already been exposed to HPV. Early protection is vital to helping protect from HPV infections that can cause cancer later in life. Getting children 10 years and above vaccinated can help keep them protected later in life. Frequently asked questions. How do you know the HPV vaccination works? Studies continue to prove HPV vaccination works extremely well, decreasing the number of infections and HPV precancers in people who have been vaccinated. Getting children vaccinated. Why does my child need HPV vaccination? HPV vaccination is important because it prevents infections that can cause cancer. Is my child really at risk for HPV infection? HPV is a very common infection in teens and adults, including women and men. Nearly everyone will get HPV at some point in their lives. Starting the vaccination series today will help protect your child from the cancers and diseases caused by HPV later in their lives. Can HPV vaccine cause infertility in my child? HPV vaccine does not cause fertility problems. However, people who develop a cancer caused by HPV will need treatments that can sometimes limit their ability to have children, such as a hysterectomy for women, chemotherapy, or radiation. Treatment for cervical precancer could also put women at risk for problems with their cervix, which can sometimes cause preterm delivery. Why do they need HPV vaccination at such a young age? Vaccines protect your child before they are exposed to an infection. That's why we give HPV vaccination earlier rather than later. Also, if your child gets the shot now, before they turn 15, they will only need 2 doses. If you wait until your child is older, they will end up needing 3 shots. Why do boys need HPV vaccination? HPV vaccination can prevent future infections that can lead to cancers of the penis, anus, and the back of the throat in men. I'm worried my child will think that getting this vaccine makes it okay to have sex. Studies tell us that getting vaccinated doesn't make kids more likely to start having sex. Would I get an HPV vaccination for my children? Yes, because I would like to help protect them from cancer in the future. Community call for action. Get vaccinated against HPV today and take control of your health.